Welcome back. Today we're doing a deep dive into something a bit different, a transcript from a YouTube video.
That's right. And this one deals with medical tourism in India.
It jumps right in, doesn't it, with a massive claim.
Oh, yeah. It states very clearly that India has the world's best medical system. Just like that.
Wow, okay. World's best. That's quite something. And does the source immediately say why it thinks that?
It does. It basically boils it down to speed and access. You know, how easy it is to see a doctor straight away.
Right, getting appointments quickly.
And getting operations done immediately it stresses. No waiting around.
So for this source, best seems to mean fastest. Is that the main idea?
That appears to be the core justification, yeah. And it uses a comparison to make its point clearer.
Ah, yes, I saw that. It mentions the UK, right.
Exactly. It gives a specific example needing knee surgery. It claims in the UK you might be waiting 3 months.
3 months, okay.
But in India, the source says you get operated on immediately. And then it kind of poses the question, which country is better based on that?
So the argument is purely about that immediate availability. Speed equals superior.
That's the angle this source takes, definitely.
But it's not all praise, is it? The source then introduces a kind of wrinkle, a problem.
Yeah, it's interesting. Right after saying it's the best because it's fast, it brings up the issue of doctors being, quote, underpaid.
Underpaid doctors in the world's best system. That seems contradictory.
It does feel like a tension, yeah. The source actually sounds quite sympathetic towards the doctors on this point.
Okay, so our task here, for you listening, is to unpack what this specific source is saying. This big claim about India's system, the reasoning based on speed and that UK comparison, and then this counterpoint about doctor pay.
Exactly. We're looking just at the perspective presented in this transcript.
So let's dig into that logic. The source picks one metric, speed.
Right. It really elevates speed of access above everything else. It doesn't mention, clinical outcomes or long-term care quality or anything like that, just speed.
And that UK wait time example is presented as the definitive proof, you could say.
That's how the source frames it, yes.
Yeah.
Immediate access is positioned as the winning factor.
Okay, but then we circle back to the underpaid doctors. How does the source square that? Does it try to explain why doctors might be underpaid in this supposedly great system?
It does, and this is where it gets quite unique. It uses an analogy.
An analogy for doctor pay.
Yeah. It compares paying for healthcare to paying for cricket tickets.
Cricket tickets? Seriously. How does that work?
Well, the source claims that the, quote, customer doesn't want to pay enough for medical services.
Okay.
But it says that same person will pay a lot of, it even gives figures like 7,000 rupees for a ticket. Or even 22,500 on the black market.
Wow.
For entertainment, like a cricket match.
So the source is drawing a line between what people are willing to shell out for fun versus, well, essential health care, at least in terms of compensating the provider.
That seems to be the implication, yeah. It's suggesting a disconnect in perceived value. People value the immediate access the system provides.
Which makes it best in the source's view.
But maybe, according to this source, they don't value the doctor's contribution enough financially compared to how much they'll spend on something like sports.
It's a really specific and maybe provocative way to frame the issue of doctor compensation within that system.
It definitely highlights a tension from this source's perspective. High efficiency and access, but a potential issue with valuing the professionals delivering that access.
So wrapping this up for you, the source gives us a very particular viewpoint. It champions India's medical system based almost entirely on the speed of getting treatment, setting it against perceived longer waits elsewhere.
And then it immediately flags this concern about doctors being underpaid.
Using that quite striking cricket ticket analogy as its way of explaining why that might be the case, linking it to how customers supposedly value different things.
It's all about this source's lens. Speed is king, but there's this value perception issue affecting pay.
So it leaves you thinking about how we define a good healthcare system. Is speed the ultimate measure, as this source suggests?
And maybe a final thought, directly from the source's own comparison. If you take that specific analogy seriously, contrasting the high price people apparently pay for cricket with what the source implies they pay for medical care, what does that particular comparison suggest about how value is assigned? And what knock-on effects might that have on a healthcare system?